Hello, everyone. Thank you for joining today's presentation from the Health Connector. Health Connector for Business, Affordable, Flexible Health Coverage. We do have a number of participants who have signed up for today's webinar, but we're going to go ahead and get started on time as scheduled. I'm Shaitra Sanders from the Massachusetts Health Connector. I will be joined today by my colleague, Nikki Conti, who will be sharing part of this presentation, and also our other colleague, Kayla, who will be behind the scenes reviewing all of your questions. To start, I would like to take a moment to thank chambers, business organizations, and brokers across the state for their support in promoting this webinar. Just a few housekeeping rules before we get started. Everyone's audio has been muted and video has been disabled. We expect the presentation to last anywhere from 30 to 40 minutes, and then we'll have time at the end for question and answers. If you would like to ask a question at any time during the presentation, please utilize the chat functionality. We will be monitoring your questions throughout. We ask that you please do not disclose any personal information or protected health information when you ask your question. We will not be able to directly answer those questions in full detail on this webinar. If you do have a specific personal scenario that you want to discuss with someone, we will be providing contact information for our Health Connectors customer service centers and instructions on how to find help from a local broker, navigator, or certified application counselor. We are recording today's webinar, so following today's presentation, you'll receive an email with the presentation and the video, so there's no need to take detailed notes, but feel free to if you'd like. So before I present, I'm going to turn this over to my colleague, Nikki, who's going to give you a little bit of a summary of who the Health Connector is.
Thanks so much, Shaitra, and thank you everyone for joining us today for this presentation. So there are a number of things that we're going to cover. As Shaitra mentioned, primarily we're going to focus on Health Connector for Business. So we'll talk about savings through comparison shopping. We'll talk about the flexible choices. She'll share a lot of information about rebates through ConnectWell, as well as the small business healthcare tax credits. However, we do want to spend time to also talk to you if you are a sole proprietor or owner only. I will be coming back in the presentation and giving you information on how you can in fact shop through the individual and family side of the Health Connector. So going on to the next slide, I just want to talk to you a little bit about what the Health Connector is in case you are less familiar. So we are the state's health insurance marketplace. So we're here to offer individuals, families, small employers access to affordable health insurance coverage. And one of the reasons people appreciate coming to us for shopping is so they can easily compare plans and compare pricing. So with us, businesses can offer small group coverage to their employees. And Shaitra will talk about the Health Connector for Business program. And as I mentioned, people who are looking for coverage as a sole proprietor can come over to the individual and family side. And so you might be wondering, who are those people? Who gets coverage on the individual and family side? And essentially, it's people who don't have an offer of insurance either through their job, a spouse, or a partner's job. So that's where people can come in and see if they can, they can just strictly shop for a health insurance plan and compare pricing, or they could see if they qualify for some type of savings. And Shaitra and I will do our best to bring dental coverage into this conversation because we spend so much time talking about health insurance, but the Health Connector does in fact offer dental coverage, and that is available for the Health Connector for Business, individuals and families, and we will spend time on that. So going on to the next slide, I won't go deeply into these slides because we really just want to level set some information about our health insurance plans. So people can have peace of mind when they come to the Health Connector and get coverage, regardless of going through the individual and family side or Health Connector for Business side. all the plans that are offered through the Health Connector meet both state and federal coverage per standard. So they're comprehensive benefits. They include prescription drugs, visits to the doctors, hospitals, etc. So you might hear some of these terms slip, but it's also important to know as a consumer that all of these plans that are available through us are known as qualified health plans or qualified dental plans. Essentially, what that means is they have been certified by the state to have all of the required benefits. So as a consumer, you can choose from a variety of plans in your area. And you'll see in a moment, we offer coverage through the main leading carriers in Massachusetts. Now, unique to the Health Connector, because we are the state's marketplace, you can, in fact, some people can, in fact, qualify for health plans with advanced premium tax credits. And these are savings that someone qualifies for that reduces their monthly premium cost. In addition, we have what's known as the Connector Care program. And these plans are for people who are in lower income ranges. And again, I'll spend more time on this in further slides, but great program, low or no cost insurance coverage. We do also offer catastrophic plans. This is for folks who are age 30 or under, or if there is a hardship exemption and that's what they really want to enroll in. And as I mentioned previously, dental plans. And then really importantly on Health Connector for Business, and Shaitra will spend time on this, but this is for small employees that have less than 50 full-time equivalent employees. So again, you're able to offer health and dental. So on this slide here, you may be wondering who participates on the Health Connector and which plans can you offer through to your employees. So you'll see I won't call any particular carrier, either health or dental out, but you can see these are the leading carriers in Massachusetts. So you can rest assured that you are comparing and offering something that is going to hopefully meet your employees' needs. And now I think I'm ready. Yeah, so you ready? Perfect.
I'm ready. I'm ready.
All right.
Thank you,
this
Nikki.
over to Shaitra.
All right. So you're going to hear again from Nikki. She's going to tell you a little bit about what's offered for those who businesses who might not have employees or who might have employees who are not eligible for employer-sponsored coverage. But what I'm going to do is I am going to go ahead and talk to you about Health Connector for Business platform. And just to review really quickly what Nikki already spoke to us about, the Health Connector for Business platform is designed for small employers here in Massachusetts who have 50 or fewer full-time equivalent employees at initial enrollment. And I'm going to talk to you about some of the benefits that you as an employer will receive by offering through the Health Connector for Business, and some of the great benefits your employees will receive by being able to shop through the Health Connector for Business through the plan that you offer. And just as a reminder, again, video has been disabled and so has audio. So if you have any questions during our presentation, please utilize the chat functionality. Another colleague of ours is monitoring that chat functionality, and we will answer those questions at the end of this presentation. So the Health Connector for Business. Let's talk about some of the great benefits of the Health Connector for Business. So certainly we're here to make sure that small employers are able to offer their employees affordable quality health coverage. And we do that through the Health Connector for Business, which provides flexibility, choice, and savings, both to the business and the employees. Here are some unique benefits of the Health Connector for Business and why employers would utilize us to offer their employees health insurance. First of all, we're a one-stop shopping solution. Nikki notated that at the Health Connector, we have all the leading insurers on our marketplace, on our platform. And so through the Health Connector for Business, as a small employer, it is the only place where you as a small employer have access to all the leading carriers in one location. We also found that we have competitive premiums. By having access to all the leading insurers in one place, you can comparison shop. And so This is an online platform. So through this easy online platform, you can actually comparison shop. And we have found that most small businesses save on average about 20% by just comparison shopping. There's also other ways of saving money, and that's through our wellness rebate program, which I'll talk about a little bit more in detail. But this is a great program called Connect Well that allows for an employer to actually receive money back for offering health insurance through the Health Connector for Business and promoting wellness within their business. There's also another way to save money, and that's through the flexible employee choice models. I'm going to talk about that in great detail during this presentation. But what the employee choice model allows for an employer to do is set a benchmark plan or a budget plan, and then allow their employees to use that plan or that contribution into that plan and choose the plan that best suits their needs. So an employer can control their costs while providing their employees the flexibility to choose the plan they need. There's also certified assistance for you. There are over 500 certified brokers that are available to help employers decide which plan is best for them. This is free for you to utilize our certified brokers. There is also no membership fees or dues to utilize the Health Connector for Business. You just pay the premium. Also, I will reiterate what Nikki said earlier. You can have peace of mind that what you are providing your employees through the Health Connector for Business, all of the plans are compliant with state and federal law. So that means they meet all the state's minimum credible coverage, and they have also received our seal of approval for quality and value. There are also some other highlights that we have on the Health Connector for Business that may be of interest to you as a business offering your employees benefits. We have plans that are compatible with health savings accounts. So a health savings account, if you're not familiar, is a tax advantage medical savings account. And what it does is it is available to taxpayers who are enrolled in a high deductible plan. Every carrier on the Health Connector for Business has at least a silver level health savings account compatible plan. So those are two benefits that you can wind up offering your employees. There is also out-of-state coverage. So if you have any employees who do not live here in Massachusetts and they live elsewhere, maybe they work remote, maybe they are in a neighboring state, we also have access to PPO plans. So those employees can also get coverage through your business. And as Nikki stated in the very beginning, we also offer dental coverage. So as an employer, you can also offer your employees dental coverage through Altus or Delta. So as I said, I talked to you in greater detail about the employee choice models, which is extremely unique to the Health Connector for Business. And the goal of the employee choice models, just to let you know, is to allow for you as an employer to control your costs while providing your employees with multiple insurance options. And since this is an online platform and everything is done through an online system, no paperwork at all, no paperwork is needed, it is very easy for your employees to go ahead and compare the options you've offered them and choose the plan that best suits their needs. And these employee choice models are called one plan, one carrier, one level. This PowerPoint will be available for you after the presentation. So I'm not really going to go into detail on this page. I'm going to actually compare health insurance to pizza to better understand what these employee choice models are. So let's talk about one plan. I just want to let you know that one plan is not unique to us. One plan is offered elsewhere, but we also offer it. And so how does one plan work? So let's say you and your employee decide to share the cost of a pizza. Your employee is going to get that whole pizza, but you as the business has decided to share the cost of the pizza with that employee. So the way one plan works is you, the decision maker, decide that your employee will be able to get a $10 pepperoni pizza from maybe the pizzeria down the block, and you are going to pay for half of the cost of that pizza. So the employee now is going to get the pepperoni pizza from the pizzeria down the block, and they're going to pay for the other half of it, but you have made that decision on what your employees will have access to. So only one option. And so that's how one plan works. And so this is kind of what it would look like if you were offering health insurance. You would choose what carrier you're offering that plan from. You would choose the plan from that carrier. You would pay a contribution percentage into it as the business, and then all your employees would have access to enroll in that one plan. So that is available on the Health Connector for Business. Now, one carrier is unique to the Health Connector for Business. You cannot find this offering elsewhere. So how does one carrier work? So let's say, again, you and your employees are going to share the cost of a pizza. Your employee is going to get the pizza, but you're going to share the cost of the pizza with the employee. So the way this works is you, as the decision maker of the business, will decide what pizzeria that pizza is coming from. You will then look at the menu and decide which one the business will be able to afford to pay into. So let's say you look at the menu and you decide the business will be able to pay half of the $10 pepperoni pizza. You set your budget. You now tell your employees that they can get a pizza from that pizzeria down the block, and you have allotted half of the $10 pepperoni pizza for them to use as your contribution. So you have given them $5. They can then look at the menu, see what's available from that pizzeria, and choose the pizza that they want and pay the other portion. So if some of your employees choose a cheese pizza, that may only be an $8 pizza. So you've already allotted $5 for them. So those employees will only pay $3 for that pizza. Or maybe they go ahead and buy the pepperoni pizza and they pay the other $5. Or they might buy the Supreme. That Supreme pizza might be $15. You've given them $5 towards it, so they'll pay the other $10. So the way that looks for health insurance is you choose what health insurance carrier the employees have access to. You choose a plan from that insurance carrier that the business can afford to pay a contribution into. And then your employees can buy any plan from that insurance carrier that's available to them and pay the difference outside the contribution. That way, those employees who might want a more comprehensive plan can go ahead and choose that, or your employees who might want a less comprehensive plan can choose that. They can make the decision on what plan they need from that carrier. Oops. And so really quickly, the other employee choice model is one level. So let's say, again, you're going to share the cost of a pizza with your employees. How does one level work? So you decide as a decision maker that all your employees will have access to get a pepperoni pizza. So you've chosen what kind of pizza they'll have now. You look at all the pizzerias in your area and you decide that the pizzeria down the block, let's say, has a $10 pepperoni pizza and you could afford to pay for half of that. So you set your contribution at $5. Your employees are then notified that they can go ahead and buy a pepperoni pizza and get it from any of the pizzerias in the area. And you've allotted $5 to them from the budget that you could afford. So then the employees can go ahead and choose what pizzeria they want to get their pizza from, their pepperoni pizza from, but they will pay the difference because, as we know, all the pizzerias will have different prices for their pepperoni, but they'll have their $5 from you to contribute towards whatever pepperoni pizza they get from any of the surrounding pizzerias. And so that's what it kind of looks like when it comes to health insurance. You would decide what benefit tier the employees would have access to. You would look at all the carriers' plans that are available to your business at that benefit tier, and you pay a contribution percentage into the plan that your business could afford. The employees can then go ahead and take that contribution percentage and buy a carrier's plan from that tier that has, for instance, their doctors in the network, because each carrier has different networks. So that would be what the employees would be shopping or most likely around for, which carrier has their doctor in the network, and they'll pay the difference outside of your contribution. So those are employee choice models unique to the Health Connector for Business. Let me talk to you a little bit about savings, money back that you can get as a business for offering your employees health insurance through the Health Connector for Business. The first one is our wellness rebate program called Connect Well. Connect Well is for businesses with 25 or fewer employees enrolled. You can have more than 25 employees on your roster, but 25 or fewer employees enrolled at initial enrollment and on the Health Connector for Business. And the way the employees participate is they can choose from more than 30 pre-approved wellness activities. They just complete one of those during the year, submit it, get approved. The employee will receive a $100 Visa gift card. And if 1/3 of your enrolled employees complete the activity, upload it, and get approved, the business will receive back 15% of what they put into all their employees' health insurance premiums as a check. So as actual money back. And again, there's over 30 pre-approved qualifying wellness activities, and the employee only has to complete and get approved for one activity during that year, during that benefit year. We know that you'll remember this at the beginning of the process, but you may forget about it during the year. So we remind you that you can get this 15% back. You do not have to ask to be enrolled. We auto-enroll you if you're eligible. We email your employees right away to let them know about this program and that they can get their $100 Visa gift card. And then we email them every month to remind them to take advantage of this and get their $100 Visa gift card. We also email you every other month to let you know where your group is at percentage-wise. So you can start mentioning it maybe at team meetings or through an email. Hey, get your $100 Visa gift card, complete your Connect Well activity. Once an employee completes their activity, they upload it online. Their activity will be reviewed. Once it's been approved, they'll receive a $100 Visa gift card. If it's not approved, they'll be sent an email. Please submit a different activity, or please correct how this activity was submitted so that we can review it and approve you. Once your group has reached 33% participation, we'll let you know that you have reached goal and that you will receive a rebate check at the end of your benefit year. And then at the end of your benefit year, you'll get some paperwork via an email. You send it back signed, and then we'll send you the check for the up to the 15% of your annual premium contributions. And just to prove to you that this is real, we did go on a little across the state, promo, and we delivered this, big check to Clean Properties. And Marcy Berger, the owner of Clean Properties, said, we heard that there would be a 15% rebate. And I said, yeah, I'll believe it when I see it. And here it is. We did give her a smaller check too that was real, that she could cash, but she was very excited to get this money back for promoting wellness within her business and receiving the rebate for it. There is another way for you to receive money back, and that's through the Small Business Healthcare Tax Credit. I just want to let you know that the Small Business Healthcare Tax Credit is a federal tax credit. So what I really want to express to you is that you should be talking to your tax professional about this. One of the eligibility requirements is that you are enrolled through a state small business health insurance marketplace. So Health Connector for Business is Massachusetts State's small business health insurance marketplace. So that automatically allows you to open up the conversation with your tax professional for them to then review if you meet all the other requirements. Now, if you met all the other requirements and you didn't offer health insurance with a Health Connector for Business, your tax professional couldn't even look to see if you were eligible for this 50% tax credit. So just remember, if you offer health insurance with a Health Connector for Business at your tax time, talk to your tax professional, see if you might be eligible for this tax credit. And really quickly, I've given you an overview of all these great benefits of the Health Connector for Business, and you're probably wondering, wow, this sounds great. How do I go ahead and get started? So it's actually extremely easy. You just come to our website, www.mahealthconnector.org/business. You'll see a homepage that looks something like this, and then you can go ahead and get started. You can maybe get a quote really quickly if you just want to see what it might cost the business. You could go ahead and create an account. You could review the documents that are needed. It is all accessible through this webpage. And then I just want to let you know that as a small business, you can offer health insurance on the first of any month during the year, and then you'll renew on your anniversary date. So you don't have any like closed or open enrollment period. You create your open enrollment period. So for instance, if you wanted to offer your employees health insurance on September 1st, you would just have to hit all these deadlines here the month prior, so in August. So you would have to offer your employees a health insurance plan by August 10th. Your employees would have to create accounts and enroll or waive by the 20th. You'd have to make your first online payment by the 23rd. And then on the first of that month that you wanted to become effective, the health insurance will start for those enrolled employees. And as I stated in the beginning, you do not have to do this on your own. We have over 500 certified brokers available for you that are free for you to utilize. These are independent brokers in your community. They can assist you. They can pull together easy cost estimates. This is their area of expertise. They do this day in and day out. They will be able to explain to you what are your plan options. What does your business need based on what they have heard from you? And guess what? You might not have time right now to shop for health insurance. They will save that time. You tell them what you need, what you're looking for, what your budget is, and they will go ahead and work on that and help you get set up. And then you can go focus on the items that you need to do your daily processes at your business. And so now I'm going to turn this back over to Nikki so she can talk a little bit about what's available to small businesses that might not have employees, that might just be sole proprietors, owner only, family run. And Nikki, I'm going to turn that over to you, okay?
That sounds great, Shaidra. Thank you so much. So I've got quite a bit of information I want to share related to the individual and family front. So the first thing I want to mention is that in Massachusetts, we do have one application for folks who are looking for help paying for their coverage, are looking to apply for Mass Health, the Health Connector, or Health Safety Net. So I want to mention that right up front, because a lot of times Shaidra and I talk about this and we say, you know what, this is we hope people who are just starting out, starting their business, maybe not even taking a salary, are aware of this opportunity. So again, as I mentioned earlier, people who don't get health insurance through their job or a spouse or partner's job, that's who we are able to offer coverage to through mahealthconnector.org. So what I wanted to show you really quickly here is that there is, when you go to mahealthconnector.org, you can right away click on Apply Now. And if somebody has ever applied before, I guess I just want to encourage you to try to sign in, try to recover your old application and update that application. Because there really is, you get really stuck, people get stuck if they try to create a new account because they just don't remember their old credentials. Customer service can certainly help somebody out. And then it goes without saying, because I think this is the first time we're mentioning them, but we are a separate organization from Mass Health, which is our state's Medicaid program, but we do have a very, very close relationship with them. And there are folks who, folks who may be on Mass Health coverage and then they come over to Health Connector coverage or vice versa. So going on to the next slide, there's some rationale here for us sharing this information with you, because we think it's really important whether you're listening to this webinar as a sole proprietor or as an employer. So wanted to acknowledge that the protections that were related to Mass Health ended in April of 2023. So that means a lot of people in Massachusetts, a lot of residents who were covered by Mass Health during COVID and this time frame are expecting to have their Mass Health coverage end. So what's going to happen is that Mass Health is in the process of reviewing eligibility for their entire membership. And this is going to take about a year to do this. So it started on April 1st of this year. And a lot of people who are currently on Mass Health may be losing that access because they no longer qualify. And they may actually be employees that may now need coverage through their employer's plan. So if you go on to the next slide, I think this is really just a reminder that in Massachusetts, we require everyone for everyone who is able to afford the coverage to have health insurance or face a tax penalty if they don't have coverage. And so we're really asking employers to help us maintain the coverage gains that we've made. And if you are, working with employees and you learn, or maybe you're going to, sharing information that, people may be losing Mass Health coverage, really just to ensure that they know that they may be benefits eligible, and help them understand what their employees' health plan options are. So on to the next slide, just a couple of things. And some of you may be aware of this and some of you may not. So loss of Mass Health or Medicaid coverage is considered a special enrollment event. and that typically lets someone, their employee or dependents, request enrollment into a company's health plan within 60 days following that loss of coverage. However, we're really trying to encourage Massachusetts employers to extend the special enrollment period beyond the typical 60 days that are required by statute. So this really is allowing more than 60 days would be in line with what all of the exchanges are doing right now during this process. So again, just wanting to encourage all of any employer who might be in this situation and thinking about how they can get, ensure that those who are eligible can get coverage through them. Just, how you can help your employees. So going forward, you're going to find that there are some employees, maybe you don't offer health benefits, or you may have employees who aren't eligible for your health plan. So they might be part-time, they may be contractors. So we want to just ensure that you're aware that the Health Connector is here as an option. You've heard me say it before, so I won't reiterate it, other than we are the state's health insurance marketplace, and if someone is seeking access to coverage and they otherwise don't have it, we really want them to come here. And if you as an employer are trying to get more information about what's going on with this Mass Health renewal and what the intersection is with the Health Connector, please visit our website. So if you go to mahealthconnector.org, it's /Mass Health Renew. And then there's a section just for employers. There's some great resources. There's an FAQ. There's an opportunity if you as an employer want to ask a question, you can certainly reach out to us that way, and even watch past recordings where we go through and explain all of this in much more detail. So going forward onto the next slide, you might be wondering, okay, maybe that's not applicable to you and you're just trying to figure out when you can apply for individual and family coverage. So someone would need a qualifying life event that lets them enroll in or change health insurance plans outside our annual open enrollment period. So typically our open enrollment begins on November 1st and ends in January, but we never want to discourage anyone from applying, particularly if they need health insurance coverage, because someone may have an event that qualifies them. So for example, there might be a change in your household size. Your income may have gone up or down. You may have just moved into Massachusetts, or you may have had a baby, adopted a baby, etc. So all of these things, including access to Mass Health coverage, is considered a lost coverage, qualifying life event. And when you have a special enrollment period, that's when someone can come in and, shop, compare plans, and enroll into coverage. Now, just so you're aware, beginning on April 1st, because everything that has been going on with Mass Health renewals, the Health Connector has extended all special enrollment periods through November 23rd of this year for anyone who has any qualifying life event. So it means not just people who are losing Mass Health coverage, but if you've had any type of life change that would let you qualify for a special enrollment period, we're opening that window longer to ensure that people can get access to coverage. So on to the next slide. I promised Shaitra would go through these really, really, really quickly. So if you're applying for coverage, there are going to be certain requirements. They're going to seem fairly obvious to you. You need to live in Massachusetts. You need to be legally here in the United States. And you need to be someone who doesn't have access to health insurance. So if someone is already enrolled in Medicare, Medicaid, any other type of public health insurance coverage, or they're offered affordable coverage through an employer, they're not going to qualify. So what do you need? So if you are here and you are trying to figure out what information do I need to gather? So do I need, you're going to need social security numbers for you and anyone else in your household who has one. You need immigration documents. You're going to be asked questions about income. So if you're self-employed, you need to get information about your net income. If you have a pay stub, we would want to see, copies of that pay stub. If you have unemployment or had unemployment during this calendar year, we would need all of that information. But important, if you don't have it all and you need health insurance coverage, simply apply, go through the application process, and then the application will tell you if you need to supply us with additional proof. So moving forward, there are two kinds of help you can get through the Health Connector if you qualify. So at the very beginning, I mentioned there are a couple of things that are unique to the Health Connector because we're the marketplace, and one program that's unique to Massachusetts. So if you're going through our state's marketplace, you may qualify for advanced premium tax credits, and that lowers the monthly premium you as a consumer pays each month. The IRS sends that tax credit directly to the insurance company. So you as the consumer simply pay less each month. And then you may be saying to yourself, like, okay, well, maybe my business has, like, maybe my income fluctuates throughout the year, and maybe it looks like that's a lot of tax credit I might be eligible now. What if it's different? Like, what if my income is different later on in the year? You as a consumer have a right to decide if you want to take all of the tax credit or if you want to apply some and not all of it. Really important keyword here is this: we're talking about tax credit. So at the end of the calendar year, when you file your taxes, let's say in this instance, we're talking about 2023, when you file your 2023 taxes, you're going to reconcile all of this with the IRS. And you may find that if you underestimated your income, you may find that you owe the IRS some dollars, or if you overestimated, you may find that you are getting some dollars back because of that. There is the Connector Care program. Now, this is a different program specific to Massachusetts, where we take those advanced premium tax credits, those federal dollars, we combine them with some additional state dollars, and those two together help reduce the premium amount that somebody would pay every month. Again, there are eligibility requirements for this. There are very low monthly premiums, low out-of-pocket costs, no deductibles. And someone who qualifies for Connector Care is going to qualify for a plan type. So depending on the plan type and the carrier, the plan that the person chooses, they could pick from a plan as low as $0 a month or $137 a month. Now, I know you might be asking yourself, like, could that be me? Could that be, how do I know? And similar to Health Connector for Business, we have get an estimate tool for individuals and families. So if you want to take a quick peek, this is a direct link, but it's also available from our homepage, mahealthconnector.org, in the upper left-hand corner. On to the next slide. We're giving you a whole bunch of information today. Shaidra mentioned that there's free enrollment assistance available on the small business side through our certified brokers. I want to tell you that there's also free application and enrollment assistance available through Health Connector's customer service, as well as our community partner organizations. So on this slide here, you can see our phone number, which is 877-623-6765. We also have our TTY number if someone is deaf or hard of hearing or speech disabled. It's 877-623-773. And again, customer service is available. It's free and they can help you with any aspect. And I do like to tell someone, if they start the application process on their own and they get stuck, really not a worry, because you can give customer service permission and they can pick up the application wherever you've left off. Now, similar is true for our community partners. We have people who work across the state, Massachusetts, who are trained and certified, and they're known as navigators or certified application counselors, and they can help you with this process from start to finish. Now, you may be looking for help in a particular language other than English, and you might say, okay, is there someone who speaks Spanish in my community? Is there someone who speaks different language? You can click on the Get Free Help near you. You can do a zip code search and find someone that you may be looking for and connect with them. And again, really important because, you know, busy time. It's also summer. We just recommend that you call ahead to schedule an appointment to get some help. On to the last slide. This is where I like to hand it back to Shaitra. I didn't do it as much today, Shaitra. I typically try to say where we're the same and where we're different.
No problem.
But I will let you go through the reminders.
Yeah, so just as a reminder of what we spoke about, on the Health Connected for Business, I spoke about what was available for small businesses with 50 or fewer full-time equivalent employees that want to offer health insurance to their employees. And that means that you have at least one non-owner who's going to enroll. And we spoke about the deadlines. You can enroll on the first of any month, but you have deadlines before the month prior. Now, Nikki spoke about what is available to maybe sole proprietors, family-run businesses that all have an ownership in it, owner only, employees who might not be eligible. Maybe they don't work the 30 hours or more for employer-sponsored coverage. So she spoke about what's available for you on the individual and family platform side, which we also have very similar deadlines, meaning the 23rd is a very key number to remember. On the Health Connected for Business side, that's the payment deadline and everything needs to be completed by that day. And on the individual and family side, the 23rd is also a key deadline because everything also has to be completed and payment needs to be made. So we tried to align so that it's very easy for you to do either side. So maybe you start on the individual and family side and you come to the Health Connected for Business side, or maybe you go opposite, the Health Connected for Business side, and go back to the individual and family side. We are available for you at any step in your business. And so now our colleague Kayla has been reviewing some of your questions on the back end. And Nikki, I invite you to come back on camera so that we can answer the questions accordingly.
Maybe I'll take myself off mute.
We got some great questions. I will just start with one that I was just typing, and I'll let you say it out loud. But we got a question about just back to the non-group section for a moment. If somebody doesn't live in Massachusetts and they live somewhere else and work remotely, and they were laid off from a job that was in Massachusetts, so they're collecting unemployment from Massachusetts, but they live in Chicago, so they what I was about to respond is they should apply to their state exchange. So they should, healthcare.gov will allow you to put in your state, and then it will take you to, it'll either be, depending on your state, it'll be a state specific exchange, or it will be a state that uses the federal exchange, but the healthcare.gov will help you get there. And I'll just put that in the chat so you have that, but you should apply to the exchange where you live.
Great, thanks so much, Kayla. So again, this coverage that we've been talking about is for Massachusetts residents.
On the individual and family side, on the Health Connected for Business side, if you offer employer-sponsored coverage and you have employees who live outside of the state, you can offer them a PPO option through the one level or the one carrier option.
Perfect.
So I can get started on all these other great questions. So softball here, will a recording of this webinar be available? Yes. Yes, we're happy to provide that. We will follow up with that. And someone asked a good question here. Do I have to use a broker?
You do not. The Health Connected for Business platform is extremely self-service. So if you are interested in reviewing your plan options and going through what's available, you just start an account and you'll be actually able to build your benefit option right through there. Or you can actually just come, like I said before, to mahealthconnected.org/business, and you can start with a free quote and see if that's where you want to go. But you do not have to utilize a broker, but they are available for you free of charge for assistance if you need them. And Nikki, it's the same on the individual side, correct? You can do that, complete that yourself if needed.
Absolutely. So you are not required to reach out to customer service. You're not required to reach out to a navigator or certified application counselor. You can go through the process on your own, but we certainly like to provide you with that information about where you can get extra help if you need it.
Great, thank you. We had a question about ConnectWell. Someone asked how a group can participate and get started if they'd like to use ConnectWell.
Great. So ConnectWell is extremely easy to get enrolled in. So the key components is you have to offer health insurance through the Health Connector for Business. You have to have at initial enrollment 25 or fewer employees enrolled. So you can grow after, but at initial enrollment, 25 or fewer enrolled, and you cannot have already received this rebate 3 times. So that's the key. We'll auto enroll you if you're eligible.
Great, thank you. Okay. So again, on Health Connector for Business, Shadra, can you talk a little bit about how many employees a group must have to use HCB, and specifically what the minimum number of employees is? And I did send the policy in the chat, so I'll send that again. But yes, if you could just chat about how many employees a group has to have.
Sure. So Kayla, the best way to describe it is at initial enrollment, you need 50 or fewer full-time equivalent. So your part-timers, their hours could add up to a full-timer. So the key word is 50 or fewer full-time equivalent employees. And I believe there is a link somewhere on our site to a calculator if you do need assistance with that to see if you are eligible. But the least amount, the minimum amount, is 1 non-owner. So if you have 1 non-owner who needs to enroll, you can enroll them through the Health Connector for Business. So anywhere from 1 non-owner to 50 or fewer full-time equivalent employees at initial enrollment. If you grow beyond that on the Health Connector for Business, you can stay on us until you so choose to leave.
Thank you. Okay, so this, I believe, is a question for Nikki, and we did go over this, but if somebody is self-employed with no employees, what should they do?
Yes, so if someone is self-employed with no employees, we want you to come over to mahealthconnector.org, and that is the platform for individuals and families. And certainly start with the Get an Estimate tool that's available from that homepage in the upper left-hand corner. And you can just generally get a sense of whether or not you may be eligible for some types of savings. It's not a complete application. It's just a couple of steps that you can go through to get a quick quote.
Thank you. Okay, and we had a question asking how somebody can get help finding a plan that they are looking for on the website. Who should they reach out to? And I know we had that great slide about where to get help. It sounds like somebody's running into some difficulties trying to find the plan that they'd like. And this is on HCB. I'm sorry, Nikki.
Okay, thank you. Thank you. I was wondering which side.
So, well, the one thing you can do if you want to do this on your own is to utilize the free quote. The free quote will show you all the plans that are available to you and your employees based on where your business is located. So if you want to do this on your own, utilizing the Get a Free Quote, that's very quick and simple, and it will show you everything available to your business. If you'd like to break it down and see what's best for your you and your employees, utilizing a broker would be the best option. You can contact them and they would be able to assist you. And again, they're free to utilize on any Health Connector for Business related item.
Thank you. And I see that we got a question in the chat that was related to a response Nikki just gave about sole proprietors enrolling or applying to coverage through the non-group side, the individual side. Someone asked whether they apply to Mass Health or the Health Connector, or is it the same thing? And what I would say to that is we have a no wrong door application. So you come in through that link that I sent, just come on in through there. We will determine your eligibility for either Mass Health or the Health Connector. So you just put in your information and we'll tell you where you should be.
Excellent. Thank you, Kayla. Couldn't have said it better.
Okay. So we have another non-group question here. So somebody asked, can a married couple sign up for separate individual plans on the non-group side?
Yeah, so this is a great question. So typically a married couple would need to enroll in coverage into a family plan together. But I would say that if someone is, someone should think about their tax filing status. If somebody is, well, in order for someone to get savings through the Health Connector, they need to be filing their taxes jointly. So if somebody is not filing their taxes jointly, if they're filing their taxes separately, they could in fact complete, technically, they could in fact complete 2 applications. So it's a little tricky, but yes, it can be done. It's important to know, though, there are other circumstances where somebody might be married technically, but need their own application. So that someone could be, a survivor of domestic violence, and they need their own application, and they may be eligible for some help paying for those plans. So there is a process for doing that. So really just would want to encourage anyone, if they were in that type of situation, to reach out to customer service for some support. But the easy answer is, if you're married and you're filing taxes jointly, you need to enroll in your plan together.
Thanks so much, Nikki. We had a question here. This is when Nikki was reviewing the individual and family side. Someone asked, what happens if you're traveling? How does coverage work out of state?
Yep. So this is a great question, because people always wonder, like, okay, well, what if there's an emergency somewhere? So any health insurance plan that you get through the Health Connector, if there is an emergency, your emergency services would be covered. Other than that, you would need to check with the plan's network. Shayutra, I know that you were just talking about, I'm even not sure what this is called technically, but I know that there are some plans that their networks might actually cross over state borders just based on where their coverage area is. So really it's a matter of network. And just practically speaking, different plans have different processes for letting someone get out of network services. So it really, again, is going to depend on the plan that you have. But if you are traveling and there is an emergency, you don't need to worry about emergency coverage.
Nikki, I completely agree with you. Make sure, your emergency is covered, and then any kind of follow-up, you would, contact the carrier directly, or whoever's doing the follow-up would contact your carrier directly.
Thank you both. That's great. Shayutra, this one is for you. We had a question about Health Connector for Business and whether there are any minimum participation requirements.
So this is kind of a unique question. So let's describe how the participation works. So just remember, so as a small business on the Health Connector for Business, you would need at least one non-owner to enroll. But we do have participation requirements. And Kayla, if you do have access to send that policy, that'd be great. If not,
Yes,
it is
I will do that.
available. The policy is we need at least 75% of your full-time employees to respond through their enrollment process as either enrolling or waiving with a valid waiver. So a valid waiver is that they have health insurance elsewhere, whether it be through a spouse, through another job, through individual coverage that they might have. Maybe they're in another state, they have individual coverage. But we need at least 75% of the eligible employees to reply back with either an enrollment or a valid waiver. So that is how our participation works. So say you have one employee who needs health insurance, but you have 4 employees. We would need at least 3 of them to either enroll or waive with a valid waiver. So those other 2 employees need to have valid waivers for it to become effective. I hope that explained it pretty clear.
Yes, I think that was great. And I did send the policy, and I also sent the link to all of our policies, if that's
Great.
helpful for
Thank you.
folks. Okay, so we got a question about how we get feedback, how Health Connector for Business receives feedback from businesses about their experience using the system, which is a great question. And then they ask who they can speak with regarding issues that they've encountered along the way. So Chaitra, I'm happy to pass that over to you, and I can fill in if needed or if helpful.
Great. So we do conduct employer surveys every year. And Kayla, I know you have a little bit to do with that, so thank you. And if you have any comments, concerns, questions, improvement ideas, feel free to contact our customer service number right here, the 888-813-9220. Our customer service center will be able to speak to you. If it's something that needs to be reviewed by someone higher, they'll refer it over to us. But yes, feel free to contact our customer service center to suggest any issues, concerns, questions.
Great, thank you. And we did get another question just about the presentation being available, and I'll just say again, yep, we'll send it around. We will have the recording available for you in the this slideshow, so you can take a look at that. We got a couple of questions about people who have fluctuating income. And so that we know that this happens quite a bit, especially for people who have their own businesses. So whether your income is fluctuating and you may be eligible for a different level of subsidy in the Health Connector with a Health Connector plan, or maybe you're newly eligible for Mass Health because of your income change, that should all happen in the system once you update your income. But Nikki, I will turn that one over to you if you want to talk a little bit about what someone should know if they have an income that fluctuates often. I'm happy to send some resources that I know we have in the chat as well. So I'll hand it over to you.
Thank you so much, Kayla. Everything you've said, correct. I would just suggest if somebody is trying to think about, just very, very practically, if they're trying to think about, okay, how do I enter my income if things are unknown? We're in July, so essentially you would want to consider everything that you have earned from January of this year to this month. And then as best as possible, you want to guesstimate what you could make from now until the end of the calendar year. So you're going to enter this information, and it's going to come up with like an annual salary, an annual income for you. Once you have this login though, once you've got a login to our application, if something has changed or when something changes, you do want to update your application information up, specifically your income section. So when I was mentioning earlier about reconciling tax credits, you know, that's very real. You know, sometimes people underestimate income and then have to pay money back, and that's never, you know, never good news. But if you overestimate income, you might see some dollars coming back. It's really just really critical. And if you don't feel comfortable updating the application on your own with your new income information, you can always call customer service or even an assister to help you.
And Nikki, I just want to point out that, you know, income has nothing to do on the Health Connector for Business side.
Perfect.
So that's, you know, on the Health Connector for Business side, no one's income is looked at. Kayla, we're actually at the 12:59 mark. Is there a very pertinent question that we can answer really quickly, or would we be able to follow up with everyone else's questions?
I think we can follow up with everyone else's questions. There was one I just wanted to touch on very quickly. I saw a mention of someone with pre-existing conditions. I just wanted to make clear that the Affordable Care Act made it so that plans cannot exclude somebody for having a pre-existing condition. So that is not allowed under the Affordable Care Act. So no one needs to worry about that. We will never, no one will deny you if it's an ACA compliant plan, which all of ours are. So just wanted to put that out there, and please feel free to follow up if there are any other questions, and we'll go through these and make sure we didn't miss any.
Yeah, and can I squeeze one in that I saw come in? I know
Yeah.
it's 1 o'clock. I so apologize. But there was a question that came in about someone losing access to health insurance coverage on 6/30. They lost their job and they were wondering if they could come to us instead of to enrolling in COBRA. And the answer is yes. Just when you call our customer service center, actually you're going to need to call our customer service center because you're beyond the date for July enrollment. And let them know when your jobs coverage ended, and you can ask to see if they can retro enroll you into July coverage. But please do call customer service. Sorry, that was the only one I wanted to sneak in. It's still technically one.
No problems. So
That's
thank
an important one.
very important. Thank you for sneaking it in. We just want to thank everyone for joining us today, learning about the Health Connector, what's available to you as a small business, what's available to you as a sole proprietor, owner only, what's available to your employees, what's available to your neighbors. So thank you again, Nikki, for presenting with me, and Kayla, thank you so much for handling the questions and providing some feedback to the attendees.
Thanks, everyone.
Thank
Thank you.
you.